Winnipeg Health Sciences Center Children's Hospital recently launched a project to build an Indigenous community healing space for kids and their families while in hospital. The project is being led by Dr. Melanie Morris, Canada's first and only Indigenous pediatric surgeon, and she joins me now to chat more about the project. So, Dr. Morris, can you start by talking a little bit more about this new space?
Yes, this is an exciting. It's a historic moment. It is an incredible time where an institution, so the leadership of an institution and an entirely Indigenous, it's actually been a female Indigenous team, have put together a project from a grassroots level that has been adopted by the institution. So I think this is very important to recognize that it's a pretty historic moment of a step towards reconciliation where we have devoted a almost 2,000 square foot space that will be the Indigenous Community Healing Center.
So, what kind of features will this new healing space have?
Because it's large and because we're going to sort of create programming within it, there's been devotion of different areas to different ideas and projects that have grown from this collaboration. And so one is sort of a literacy project. So it's essentially a space that'll be a built-in wall library that will have books of Indigenous languages. There'll be a space where there's going to be some privacy and furniture that would reflect to encourage breastfeeding practices. There's going to be a kitchen where we can cook Indigenous foods. And then the central main area will have stools where they will be able to sit and gather in a traditional healing center space that could be led by elders and by other knowledge keepers and community members. And then we've engaged with Indigenous artists from the community who are going to do some programming, so drum making or beading or sewing to have build that capacity within kids, especially those who are here for long periods of time.
Where did the idea for this space come from?
It kind of stemmed a little bit from a moment when I started my practice. When I was working here, I got a card from a patient who said, "Thank you, Dr. Morris, you made me feel safe." And it stunned and broke my heart because I thought, why should a child in our institution who comes for healing need somebody to make them feel safe? And that's when I sort of looked around the walls and thought, maybe there's some work to do here.
What's kind of the process of starting this project and getting this room actually built?
We had this idea, and an idea comes from one person, but the plan, the execution, and the final product come from a team. It's sort of a two-part process. It's an Indigenous grassroots project with Indigenous designers, elders, knowledge keepers, and community stakeholders, as well as different organizations within the Indigenous community. And those are to inform both the structure and content of the room. The second piece is the institution themselves.
Why is a project like this so important?
So, I mean, you see, I'm wearing orange, but that we're living in a difficult time. I think so. Like as Indigenous people, our grief is pretty raw right now. I think we are discovering unmarked graves, and that we're just learning about the truths that we sort of already knew, but that are becoming significantly more in the public and the awareness. It just resurfaces a lot of the pain that has existed in this community, but it also brings forth the fact that the status quo is just no longer acceptable. The First Nations Social Secretariat of Manitoba just published the First Nations Report on the Health of Children, and unsurprisingly, but still should shock us, the rates of all diseases, of hospital admission rates, of mortality, of dental issues are all like 5 to 10-fold higher in our Indigenous communities, and that is just unacceptable. So we must act, and this is one of the steps where we can make a difference.
Is there any way that people can somehow get involved and help with this project?
Oh yes. So number one is just talking about it is great, because I think what it does is it opens the conversation to these things which are so important right at this time. But also, more importantly, the Children's Hospital Foundation has set up on their webpage a way to donate. So through the Children's Hospital Foundation, donation is possible, and that will always help us create something even better and more significant and have a bigger impact.